everyone hear me okay? Great. So our session today is about inherent biases and the impact on service delivery. So to just start out, I'd like to just say that as an American citizen with roots in Palestine, this is a particularly surreal time to be in a government building talking to you all about how to protect vulnerable populations. I'm sure you all have been following what's going on. But I mention it because the systems that lead to dispossession and oppression and marginalization of some groups are related to the ones that dispossess other groups as well. And the work of trafficking or counter-trafficking isn't so much providing direct services to specific individual survivors. It's about countering the systems, breaking those systems that keep on recreating the problem, right? There's a old parable about two people walking along a river and they see babies floating down the river, and one of them jumps in and tries to rescue them, and the other one runs off. And they say, where are you going? Why are you running off? I have to go and find who's throwing all these babies in the river, right? So this session is really about what we can do to make a difference, what our agency is, right? It sort of builds on the last session about power and making a difference. And we're all in this room because we think that we can make a difference. So we're going to talk about that positionality as a change maker, as an agent of change, as someone who works with survivors in whatever program or project. How we, basically two issues. One, how we address our own position as someone who's got their own reasonable interests in the work. Maybe we're earning a livelihood doing this work. We have bosses to answer to. How do we take responsibility for that and reflect on our own biases to make sure we're being responsible with the power we have? And the second issue is how do we understand or how do we make sure that those officials and authorities who are responsible for countering trafficking and the general public also have a clear understanding and are not clouded by their own biases to make sure that the systems function as they should to care for people. So with that, we'll kick off. We will give each of the panelists a few minutes to introduce themselves and the projects that they've worked on and the organizations they're coming from. That will then frame our discussion as we get further in.
Good morning, colleagues, friends. I'm a little challenged, so I'll come to the side so you can see me. Actually, I want to show off my logo, right? I'm from the Caribbean, Jamaica, where there's no sun, no snow, actually, no wind, all those things that you're jacket up for. I'm glad I'm only here for a few hours, but I'm very grateful for being here. Thanks for having me. And so, just to talk a little bit about why I'm here and frame it in the conversation that we're having around inherent bias. My name is Joy Crawford. I am the co-founder of E4Life. You can Google us, so we won't waste any time on that one. But just to say that I've had a long history working with Winrock in different capacities as they have done their work in Jamaica, and to support us responding to child trafficking and human trafficking in general, also some other activities surrounding helping our security forces to respond during training and co-facilitating that, as well as having some of my survivors in my organization be speakers in some of the forums that took place in Jamaica. So we've just had our 2023 trafficking report. Of course, you know, that's from Global. And I just want to share four main things that came out of our recommendation. It had 10, but 4 I think is important for what we're going to talk about here today. And this is about Jamaica. That there's a need to increase efforts to investigate issue around trafficking, especially from the official lens. How does the government Eric spoke about institution and government. What is their real motive behind the trafficking response, and how does it affect the services that we deliver? Also, just to look at the issue around the ability to inform the public, inform communities around it, collaboration with more civil society partners, as, how do we really play a role in it? And so I want us to look at those four. Just bear those in mind as I move forward in the discussion. Also, for us, who are the traffickers? I was downstairs at the other forum, and I kept thinking about the word survivor. And I don't know if we've clearly defined who's our survivor, because the survivors are so diverse. Trafficking is so diverse. And I was asking myself, do we need to anchor it in the general unique definition about what human trafficking is, or should we really be going broader? So I thought about that. And in our situation, for me as an organization, we experience more child trafficking, because my population would be the average young girl between age 12, so 24, 26, who is an adolescent mother, which means I should have had an unplanned pregnancy. She is now infected with HIV, and also she's a survivor of childhood rape and incest. So that's a profile, and so we think about who is this person. I just want to put forward quickly that cultural humility, for me, from another lens, is one of the key components of addressing this issue of intrinsic and inherent bias. It's how do we really put ourselves as learners in this dynamic world of trafficking? Are we lifelong learners? Are we coming purely from academia? Do we really know everything we need to know? And I put it to you that we really don't. But if we're not in the mind of listening to the survivors, who are the real teachers, then we are not going to be able to build good service programs. I also want to say, be at peace with privilege. I have found that as we've done the work, it's very hard to get out of the othering. And if we are going to be good service providers, we need to manage our own personal privileges, be comfortable with it. It's okay if you were never trafficked. It's okay if you're not a survivor. It's okay. Accept that and now move forward in an empowered way. And then the final one is just about enhancing the enabling environment within communities. So we had an opportunity about 3 or 4 years ago to do an intervention. It's all here on the screen for you. But the main thing I want to point out in this is that it was a child compact project to do awareness building in grassroots communities in Jamaica during COVID time. It was placed online. It was done through the University of the West Indies, and E4Life was asked as a partner in the community to take the lead on some of the reach. They had an objective of reaching 180 persons with information. At the end of the time, which was about 2 weeks, we were able to reach 352 persons online in communities. What that said to me was that communities are interested. Grassroots people want to know about it and can know about it and can respond. I think that's another thing that impacts us, that we really seem to think that the issue around human trafficking is so complex and so high and so dangerous that we keep them out of it. But it can happen. Communities can respond. And what we learned finally about this was that they want to know how. During the COVID time, as we discussed with them about what human trafficking looked like, they were the ones who instructed us to say, listen, me, we now have truckers. We have places where the trucks were stopping, the kids were not in school, they were hanging out during the day. And that's where they were getting involved in sex slaves. That's where they were being moved from one parish to the next. That's not in our textbooks. You know? The communities are the ones who can tell you what are the new trends. I hear we're talking about trends. If we're going to do service delivery, we have to listen to community. They know what the trends are. They know when the language changed, long before we have done our research. And also that pandemics and natural disasters are breeding ground for human trafficking. So I want to say thank you very much. That's my introduction. inherent biases. Let's get it done and let's provide better services. We can be more client survival centered. We want to become more competent and not just aware. And we want to make sure that we are healing and not hurting other people. Thank you.
Hello, good morning. My name is Helga. I come from Argentina. I apologize for my accent. If you don't understand something, just let me know. I work for an NGO, a civil society organization called DYA. DYA is a regional Latin American organization that has its headquarters in Ecuador and has offices in Peru and in Argentina. That's where I come from. And in Argentina, I'm responsible for the research, monitoring, and evaluation area. We are an organization that aims to improve the lives of the vulnerable population, especially children. We specialize in child labor in different supply chains, and we work with migrants through the implementation of different strategies. Some of them are to promote the public and private dialogue, to develop social compliance systems that are sort of human rights, child labor, due diligence models for to implement into the production of different crops. We promote livelihood initiatives. We promote educational and health services to this population. We train and we raise awareness on the topics that we work on. We develop public policies with government stakeholders so they can provide services adequate for the topics we talk about. And then we conduct research, monitoring, and evaluation. DYA Argentina has been open for 7 years. DYA regionally has been working over 35 years in the region. And we have a way of approaching the problems we work with from a multi-stakeholder approach. So we do coordination among stakeholders. That is basically the problem of most of the problems we approach. And in Argentina, we have been working with education, with population, youth, and adolescents, introduction into the work of labor. We have been working with child labor in agricultural supply chains. We are actually working with blueberry and with yerba mate. And in 2021, we were the implementing partner for the Atlas project with Winrock. And then we started working with other topics other than child labor, and we started talking about forced labor and human trafficking in the garment sector. So we started implementing Atlas project in Argentina with the supply chain of the garment sector. So basically the strategy was to work with the victims, identifying the needs with the victims. It was designing the solutions and trying to come up with programs and policies to resolve and to implement those solutions. And these were by working with victims, with the government officials, and with the companies and or unions wherever they want. They are present there. So this is some of the introduction of what I'm going to be talking about with the rest of the presentation. Thank you.
My name is Mirella Beltram. I am the associate, that was me. I am the Associate Director of Partnerships at Polaris. I've been with the organization for over 8 years now, based in Washington, D.C. So unlike my colleagues, I did not travel here. Unfortunately, I wish I could have traveled from somewhere. So I am here today a little bit different than my colleagues. Polaris is not a direct service provider, so we do not provide services directly to victims and survivors, but we do have direct response. So at Polaris, we like to talk about the ways that we impact trafficking through our theory of change, which is through 3 core models. One is through direct response. Polaris is the operator of the National Human Trafficking Hotline for the United States, and we have been operating that hotline for the last 16, almost 17 years. So we, through the hotline, have the largest data set on human trafficking in the United States. the way I fit into this conversation about inherent biases is that we see on the hotline how inherent biases affect the calls that we get on the hotline, how signalers view trafficking, how victims and survivors view trafficking themselves, and how it leads them to be unable to identify as victims and survivors. The other two parts of Polaris that I would be remiss and get yelled at for not talking about would be, of course, our research and intelligence unit. So because of the hotline, as I said, we have the largest data set, but we also work, our workers' rights team works with Nonechka, which is an app and a mobile app that was created and designed specifically for workers in the United States, migrant workers that work specifically in agriculture, to kind of learn from them what their situations look like, how they came into the country, et cetera, to kind of gain information anonymously so that we can then use that data to promote good legislation towards workers' rights in the United States. And then our campaigns and public engagement. We are based in Washington, D.C., so we would be remiss in not working with legislators to help them understand what trafficking looks like, not only at a national level, but also within their own regions or in their own states and cities, to help them and understand trafficking, but also help advocate for laws that benefit and help victims and survivors. Through our public engagement team, that's also where we combat inherent biases a lot. Our public engagement team works very hard on social media to put out information that combats myths and misinformation about trafficking. I'm sure you guys have seen online, unfortunately, TikTok, Facebook, and X, which used to be Twitter, is where people now spread all kinds of information about trafficking, and most of it is not true or correct or sensationalized. And so our team works very hard to understand what are the myths or the conspiracy theories that are being spread through social media, so that our public engagement team can actually counter it. Not only that, but it allows us on the hotline to be able to see as well what these myths are and what kind of calls the hotline might be getting, so that our hotline advocates can be trained in how to react to them and how to respond to them in a victim-centered way, but also educating the public at the same time. So National Human Trafficking Hotline, obviously, that's what I'm here to speak most about. So there are 5 ways that people can contact our hotline. Phone, text, online chat, email, and web form. We are 24/7, which means that we never close. Most of our hotline advocates, which are the ones who answer the phone, are now remote since the pandemic, but does not mean that we have stopped working. We are toll-free, which means that it is free to call within the United States. We are confidential in that we do not record any of our calls. We do this because it's our way of being survivor and victim centered. We never want any information that is on our hotline to be inadvertently used against a victim or survivor. And so our hotline advocates take notes, and we have a database system in place that our hotline advocates use that then our team uses to analyze and collect information. And then the last thing on there is that we're available in 200 languages because we work specifically with an interpretation agency. So our hotline advocates can get in contact with an interpreter of any language within minutes. And the last thing, which I was so excited for Eve to Life to mention, was the fact that they are in the GMSD. This is another way that we do direct response. The Global Modern Slavery Directory is a directory of over 2,600 organizations around the world that work on trafficking in some way. It is operated by Polaris. We strongly urge anyone to use it to find resources near them. But we've also learned that most service providers use it in order to find out what other service providers are doing, but also maybe they have a client that they aren't able to serve, so they need to find another organization that might be able to serve them in that need. So yeah, and I am done.
Okay, it's on now. Right. Thanks for those introductions, guys. So one of the things when we were prepping for this panel, we talked about each having experiences one way or the other with encountering authorities who had vastly inaccurate understandings of trafficking and failed to recognize it. You know, we've heard testimonies of, doctors encountering women who were forced married and being forced impregnated and not recognizing it. Border guards who encounter someone who's been trafficked and into forced labor and arresting them as, illegal migrant. So these things happen, and it's somewhat surprising to know that what you've seen is also a pattern. Almost everybody, I'm sure, who works in the space has seen this, and we wanted to emphasize that this is a common phenomenon and pattern. But each of you have touched on, in some ways, how you encountered that and sort of addressed it in your work. Would you like to speak to some of those examples?
Okay, thank you so much. In the context of the work that we do, meaning E for Life, our primary focus when we started our work was around HIV and adolescent girls, and how pregnancy got into their lives and what were the nuances. Within the first 2 years, we recognized that there was a direct link between incest, child rape, and the girls that we're working with. And of course, once you have that, there's a conversation around justice. What does justice look like? And so we engaged some of our colleagues from the legal system in Jamaica, and had them come in to talk to us, to train us around what legal literacy would look like, how do we learn about the court system, and to help our survivors. But one of the main things that came out in that, which is actually where I think our interest or our radar around trafficking started, was the fact that in the true definition of human trafficking and child trafficking, where we could not prosecute someone on rape or incest or those things because of all the nuances, the family stigma, the evidence wasn't collected properly, all those different things that most times allow a case not to be prosecuted, we could actually be having some of these men charged for trafficking. And some of these spaces, if we were looking at trafficking first in terms of what was happening to the girls, how they were being forced and how they were being held against their will, and how sexual violence became a part of their community, and what was the involvement of their family. That kind of was not the lens. So we saw it as an opportunity that probably we need to start looking at a broader, as you've said, recognition of what human trafficking was and child trafficking. The issue of child shifting in our culture. It's very easy for us to, again, the girl who is pregnant, she's a shame and an embarrassment to her family. So what they would do is that they would move her from the household she's in to another household. And when she gets into that household, most times it's a distant relative. And so she goes into the household, she has the baby, she never goes back to school, she now becomes the domestic helper at the house. Those kind of things happen to her, but was never defined as trafficking. So we saw, definitely, I agree with that, a need for us to be able to unpack the issue of human trafficking outside of people being on a boat in chains, going from one, because that's the general idea. Once we say human trafficking, at least back home, it doesn't seem very real. It's out there, and I think policymakers, even the police and how they respond to it, are missing this other group of women and girls and boys who are actually being trafficked. We're now talking about the boys who are on the road wiping the glass and stuff. So that's a recent conversation in the last 5 years or so. But even with that, I think we're missing it because we're not calling it. We probably call it child abuse and neglect. So I do think that there's a need for the language and understanding so that we can have our policymakers and our providers see it for what it is, so that we can actually, prosecute and help our kids.
Okay. Is it okay?
You have to put it closer.
No? Closer. No? Okay. Okay, good. So what we found in Argentina when we were starting to make an intervention on these topics that really took us outside of our comfort area, because we were really used to working with child labor, but not really with other topics as forced labor and human trafficking for labor purposes. we started with a diagnose, trying to understand the complexities of the situation. So one of the first things we understood was that the problem was that the garment industry is mostly family-run, middle-scaled family work of migrants, mostly from Bolivia, mostly women, with their children that work in sweatshops, and all their labor rights are not being respected. These sweatshops are usually located in peripheral neighborhoods, really far away from downtown or through the centers that they have accessibility to any other services. And there are three conditions to consider from the Argentinian system. We had national stakeholders with really interesting competencies approaching these topics, who had no accessibility to the territory, had never been in touch with victims, or did not really see what was going on in the territory. So they were, like, in theory, developing solutions, but not really talking to the direct victims of this specific topic. Then we had local governments not seeing it as a problem at all, thinking that they are from Bolivia, it's a cultural thing, they are used to working in these conditions, so it's not a problem. And then we had the migrant population that was not receiving any services designed with an intercultural perspective. They wouldn't even perceive themselves as victims. So we found this scenario that it was a bunch of intersectional inequalities where we needed to start thinking about how to approach it. So we conducted a first preliminary qualitative research to reach a first approach to the community and try to understand what was happening. And while talking to women, to organizations located in the zone, this is I'm talking about a neighborhood that it's in the third column, far away from the city of Buenos Aires, within the greater Buenos Aires area, where the biggest informal fair of exchange of clothing from South America is located. It's called La Salada, and a phenomenon that happened is that when you have one of these really huge hubs, you have a lot of sweatshops around that are the providers of the elements that are being exchanged in the fair. So we selected that place to start working there. And while approaching the community, we found out that they had inexistent accessibility to any of the services that are usually provided to any citizen, like education, health, justice. And they had no accessibility to proper information about their labor rights. In Argentina, there are a lot of labor rights that they were not being able to enjoy because they didn't know what to ask for. And we found out there were many stigmas and stereotypes that fell down on them in the provision of these services from the local governments. So basically, the big problem we found was that there was a lack of knowledge, and nobody, nor the local government perceived it as a problem, nor the victims. So it was a good start to work on this misinformation problem.
Just to follow on what she said, so if Jamaica is tier 2 ranked for human trafficking, and you see the recommendations that I had there, but because we work so closely with the US, we have to do something. So we have been at tier 2 for quite a while because we're meeting that requirement, which is a government obligation to the US and to our international partners. We won't move from tier 2 because the concern, the motive for the interaction is not yet at the survival level.
Yep. Sorry, just I want to. We're nearly out of time. I want to have some time for audience questions as well, but just maybe Mirella, as you answer, and just to follow on from Helga, if you get a chance. What you do from your position, your unique position to counter those things, like in the example of working in the sweatshops, how did you manage to build those relationships with children in child labor and build the trust necessary to bring in city officials who they might normally be scared of to have a conversation about how do we work together and get services? But yeah, first, Mirella, if you want to speak to those questions.
I can't answer that because we do not work with sweatshops in Argentina, unfortunately. But I think the one thing I wanted to bring back to the question you asked earlier, Eric, was about the misinformation and how it affects people who are in levels of authority, right? Law enforcement, border control guards. It's not just them, but it's also our legislators or people who are making laws. When you have misinformation that is spreading from the constituents, they're the ones who are calling their representatives and telling them, and they're the ones who are voting and want to see laws about human trafficking as they see it, right? Because they've seen a Facebook video or a TikTok video that has sensationalized trafficking to them, and that they truly believe that's how trafficking happens. And they are then calling their lawmakers and asking them to pass laws that we in the anti-trafficking community know is going to be harmful to survivors and to victims. And so how we combat that is by, again, like I said before, is really working hard to understand what those misconceptions are, and then going on our own social media platforms and pushing out a true narrative. But it's also using data and information. Polaris considers itself to be a data-driven organization, which we have the Human Trafficking Hotline, we also have Nonechka, but we also have the National Survivor Study that we conducted over 3 years, which was built with survivors, for survivors, by survivors, and we were able to gain a lot of information, a lot of knowledge that we are now then putting out back into the world to counter those narratives, right? Right now there is, or actually a couple of years ago at this point, everything is blurred together since COVID for me. But, there was that narrative on Facebook and TikTok, I don't know if you guys saw it in the United States, where it's like, if you see a car seat in the parking lot, it means that a baby was just stolen by a trafficker. And we're like, that's not how trafficking happens. Or if there's a zip tie on your car, that means you've been identified by a trafficker and they're coming to get you. Which we all know in the United States, that is not how trafficking happens. But we got thousands of people calling our hotline to report. Not that they had a zip tie, not that they saw, but they saw this post on social media, and they were so convinced that that is how trafficking happens. And therefore, they then go to their congressmen and to their lawmakers and ask for laws specifically about that. And so we want to use data to show what the true story is, to really battle that misinformation and those myths, so that even lawmakers understand the true scope of human trafficking and are able to make good laws. And I'll let the sweatshop.
Well, as I was mentioning before, what we do is we work with the community. So first of all, we identified what the key stakeholders were there, so we needed to start working with. There? Yes. Yes. Can you project the slide? Okay. So first of all, while we were conducting this exploratory study, we identified that the community radios were really important to get to people. Everybody listened to it. It was listened in the fair, in the sweatshops, in the homes of the people. So that was a key ally to work on the misinformation. It was basically, we had to come up with simple messages as, these are your rights. You can get an ID. That's the ID is what you need to access every service in Argentina, and they did not have that information. And community radios were from people from the community, mostly migrants as well. So we had to come up with the messages in the indigenous Bolivian languages so everybody could understand, because not everybody could read. So this was a good strategy. And a second one, and I promise I won't take long, it was to develop it is a research methodology, but really helped us to build along the process that is called a social cartography. So we arrived to a new neighborhood. It was a strategy that worked locally, and we worked with all the organizations that were there to build a map and to call for all the stakeholders to be there. So this strategy really helped us to identify the problems, to raise awareness, not just with the victims, but with the government officials that were there, with the local services, with the national stakeholders that had competencies on this topic, but were not listening to the victims. So they were, while we were building these maps, they were listening and understanding the complexities of the problem. The result of this was the design of a plan that we got the local authorities to commit budget to implement. So it was a really insightful strategy.
Lovely. So yeah, we have a few minutes left. I'd just like to open up to any questions, comments, questions, get into the discussion.
Thank you. And thanks for the perspectives, and really, thanks for all the great work that you all are doing. This is more of a comment, but I'd invite commentary back on it about sort of how we talk to our policymakers and our lawmakers. Right? I happen to now work for one of those, and great work from data-driven organizations like Polaris and IJM and Winrock, and really, I think, despite what we might see on TV, I think most policymakers really do want to do the good thing. They really do want to make the right laws to address real problems. They have a hard time getting answers on what those real problems are. That data-driven approach is wonderful, but then one meeting from a data-driven organization a quarter versus 1,000 phone calls from well-meaning but worked-up constituents sort of combating that on the other side really presents a challenge, I think. And so I suppose that, one cynical take on this is, despite maybe everyone's best effort here, there are almost certainly dozens of articles of clothing or items in this room that have been made by forced labor, just as one example, right? And I think the cynical take might be, if I, as a policymaker, can do something that seems like I do care, even if it doesn't mean I get to the biggest part of the problem, I'm not necessarily trying to upend the entire economic system with the law I'm about to pass, but I want to signal that I care. I suppose this where the comment / question might come in then is, how do we address that? I mean, hot takes on this are welcome. Be happy to take this back to the office, whatever you say. But yeah, throw it back to you all.
Okay, so we don't have sweatshops in Jamaica the way they do. But I was listening to the engagement around policymakers, and I think about another model that we've used. So language is important. So human trafficking and child trafficking in our culture is almost a panic attack. Okay? So it's really what is the manifestation? So a lot of what we see now is the issue around sex trade and sex trafficking and child shifting at a community level. How do we link that with a language that is soft, where most people will come around? So a lot of our people will coalesce around child protection. They won't respond to child trafficking language, but child protection is easier. And then for us as an organization, we like to bring them in without the cameras and the publicity to actually meet and see the victims or survivors. So sometimes we've had them come to visit our support group meetings strategically because, they may say they're interested, So when they get a chance to meet the person who is actually as a victim end, we have found that they start to understand how they can now frame that language with their colleagues. So we have developed allies who are not yet ready to go public and say, I have a stance on this, but they start the conversation. It may mean wearing a purple ribbon during Idaho to end violence against women and girls that they now are willing to wear because the process is going on. So I've found that if we can find soft entry and the language that they can share with their constituents that's not so aggressive, works. So it's baby steps where they may eventually become vocal advocates. The other thing that we have been able to do is to invite them to, they will come to events. So for example, in Jamaica, LGBTQI is also another panic attack, okay? But again, with the same approach, finding ways to have them come without the camera. Years later now, 2023, we have politicians who will attend a public meeting that's hosted by an LGBT organization. So that for me is a suggestion. How do we engage them outside of the camera and then find who the allies are and then use the baby steps?
I would agree with the allies part, right? Like, make sure that you are aligning yourself with organizations that are reputable, that are doing good work. I'm not just saying us. There are so many good organizations out there that are doing so much in the anti-trafficking field, but also putting out the correct story as well, right? Not allowing for sensationalization of trafficking, not putting out narratives or reposting things that somebody else has put in that has no, that has not been fact-checked or anything like that. I think those are just baby steps that even any policymaker could make, right? Those are the things that I can think off the top of my head.
Okay, it's really interesting what you bring up to discussion. It was the goodwill for the policymakers. It's always present, and that's why most of the time they're working there. And they had difficulties on reaching the territory. So what they would thank us to bring them to the territory. They had all the willingness to come there and to intervene and to know. And sometimes Argentina is a huge country. It's a federal country. It's hard to reach the victims and to really know. So we were just facilitators of that dialogue, and they were able to come and hear the victims because we facilitated the space. That was our key role there. So, yeah.
And also engage survivors always. Always engage survivors. They know the story best.
Helga, could you just say a bit more how you manage that position? You know, how did you connect with both the authorities and the very local ones? How did you get the trust?
Yes. Well, we had some to come up with this strategy. This strategy was just an excuse to get everyone talking about the topic we wanted them to talk. So we first of all approached the community, and we had 2 sessions developing pictograms that are images that we prepared with them so they could participate in the workshops of building the mappings, and they selected the images. I brought some here to show you, and I can pass around, because they were all selected and designed by the community. They are images, well, like these ones or these ones, with all the problems that they were seeing while we were discussing, and they would have to print into the map. That's why when you were looking at the map, you were seeing these pictograms. So this was one of the first approaches we had, so we could actually represent the voice of the people from the community while working with them. Then, secondly, what we did was to find a trusting space within the neighborhood. So we work in childcare centers, in the community clubs. So they were trusting spaces for the community, so they could speak out loud. And we invited local authorities, national authorities, anyone who had the competence there to understand, to be a part of the process. It was a collective and participatory methodology they worked around. So while we were discussing and trying to map things like services, like accessibility to light, water, or other public services, accessibility to schools, and some things related to the garment industry. So identifying sweatshops. What you can see, what I have circled is you can see it's a pictogram that they proposed, that it's the front of a house and a sweatshop behind. How they would identify families living in sweatshops. There is a pictogram designed by them for that, so they would be pointing out. You can see a nasty toilet there. That's the conditions in which they were working. So while they were building the map, they were identifying different problems they were facing daily and talking about it. And local authorities were listening to these problems. So that's, this provided the keys for them to build up the solution, the program and the solution to address these problems. I think that's it.
So it seems like in this case, it was as much about just general services as it was about countering trafficking itself. They're all mixed up together.
I remember I forgot something. You can see that the map has no references of location, so they could speak out free. There are no streets. It's just a regular map, so they can locate the places, but no one could be blamed, so they could freely speak and not being blamed or detained because the authorities were participating of the process. So in respect to that, we had no reference whatsoever there. That's just a simple, really with high density neighborhood.
Nice. More questions, or do you have a comment? Anyone else have a comment or question? Contribution?
I had a question about the work taking place in Jamaica. As you start working with survivors of these issues and you start talking more about defining kind of the child work and child labor and child trafficking, I find that kind of stage to be really interesting. And I wonder about what programs are going on or what is taking place and what you're seeing in survivor advocacy, and like how the survivors now learning the definitions of what took place and what happened to them, and giving them kind of the words to describe their situation. How have you seen their growth as survivor advocates and survivor leaders?
Okay. Okay, great. So what we have benefited, we're 15 years as an organization, and I think I was talking to one of my colleagues this morning who is actually doing some work in Ghana, and one of my early babies, Rochelle, for those who know her, she is a survivor. She was infected with HIV by the same man who infected her mom at age 9, and experienced child shifting, those kind of stuff. She's been with us for a number of years as a survivor. She became a member of the staff. She started to speak, found her voice, spoke internationally on several, and just moved her new family to Ghana last 4 months ago, 15 years later. That process is incremental. I think the biggest part of it is, like you say, is to spend time primarily with survivors. Survivors determine what their service look like. So like justice, we don't have a script on justice. Each girl decide what that looks like. Some people want the person to be found. Some people want just to move away. Some people want prosecution. Some people just want to be at peace with self. So to prescribe, I believe, that the way that we respond to initiatives for trafficking, or it's from an academic perspective, that's what we're missing. We're not having a big uptake. So I think it has to be survivor-centered, and each victim, each family determine the path, and we provide the space for that to happen. The other part of it is networking, partnerships. No one agency can provide everything for that person. So it's finding the soft, safe referrals, and the word is safe. Creating the networks of who you're going to refer the person to, or who you're going to invite into the person's space. Do they understand what trafficking is? Do they understand what the force is? So one of the things that we had a challenge with was parents. So in Jamaica, we have a law that says if you see and you don't report, you can be fined or you can be imprisoned. After we started working with our girls and they started to learn what was happening to them, they were asking us, can I prosecute my parents? because we told them. They knew we were being trafficked. They know we were being pimped out. They knew. They never believed, or they were a part of it. Can we now charge them? Because the girl, they become now aware. So they became their own self-advocates. They were now able to hold providers accountable. When they went to the police and made a report and they weren't heard, they now knew that they could take a photograph of the badge number where the police did never give them. They know that they could use their smartphones to record abuse or discrimination. And so they now knew. They know when they went to the provider, the healthcare, and something was not feeling right. So they now know that they could document. So that's another thing that we did with them. Teach them how to document in their own way. The other thing that we were able to do with them is also now we bring them together on a regular basis to, as a community, determine their advocacy plan. You know, what are the key common issues that they had between all of them? Because all the experiences were different, but there were some common issues. And in our case, the main one was sexual violence. How do we come around this? What do we want? They were able to guide us to present to our parliament a paper to say they were asking for safe and free abortions for girls who got pregnant as a result of rape and sexual violence, especially within the trafficking situation. So they were able to make that presentation because we facilitated them coming together as a community to find what their commonality was. So finding that common piece in the bigger trafficking issue was also very important. And so those are some of the steps that we have taken over the years as we work with them. Also, the other one of the other things that came out of it was that because of the work that we're doing and we're seeing, the justice systems, so when the public prosecutors and the lawyers are having their retreats, they invite our survivors to come in. Because one of the main things was that we were having a problem where the police said, we are investigators. We're not into figuring out your feelings. And the trafficking victim is saying, but my feelings is my priority right now. So having that conversation to bridge that gap, what we eventually came up with is, how does E for Life stand in the middle to help the survivor to give her a statement or to help her emotionally while she does the investigative conversation, which is very invasive. So those are some of the things that we've done. I don't know if that answers your question.
Yeah, great details. We have a question over here.
I know I'm the moderator, so thank you for letting me ask the question as well. So for Polaris project, I mean, the hotline has been such a great gathering spot of data. And so if I'm thinking of inherent biases that exist when you're getting thousands of calls about zip ties or about car seats, and then a policymaker is hearing these, I know that there are different efforts to dispel those myths. I'm wondering, as you're thinking of the increasing calls around these, as more people are aware of things from TikTok or from movies or whatever it might be, one, is there an educational component that is funded for those who are on the hotline? And then two, this is more so directed at you, what are the sorts of things that you need to actually be hearing from direct service provider organizations or from the general public that can influence a policymaker's decision-making outside of those blasts of phone calls? So what other things can we do to provide incentives? And I think that sometimes has to do with an election cycle, like where you are in that. Sometimes it has to do with the committees that you're on. But I'm just curious, like what educational components, and then what do you need from us? So we would just pose the question back.
Do you mean educational components for the people who answer our phones or the people that are calling the hotline?
The people who are calling,
Okay.
is there any sort of educational effort to dispel the myths as they are being received,
Yes.
so that those aren't continued to spread?
Absolutely. So at the organization, we are working really hard to update all of our webinars and all of our training materials on our website. You can take a Human Trafficking 101 training on our website. Highly recommend. It's available in Spanish and in English. We always try to direct our callers that are calling about that to that webinar, but also to other things that we have online. our hotline advocates are also, whenever we have a new myth or misconception or sensationalize something that's coming up that we know that we're going to get thousands of calls upon, we as hotline leadership come together and try to create language that they can use on the phones to then speak to those callers that is in a victim-centered, survivor-centered way, and kind of redirecting them gently of being like, we understand that you are very concerned about this. You know, these people aren't calling because they're malicious in intent. They really truly believe that this is how trafficking is happening, and they feel compelled to say something and to do something, and we really appreciate that. And so we want to use it as an opportunity to re-educate and to redirect where they should be looking for information. So that's kind of what we're doing on the inside. I know a lot of other organizations are doing the same. So we also try to amplify the voices of our partners. We try to amplify the voices of our survivors that we work with that are on our advisory council, et cetera. So that's what we do internally to re-educate. Hopefully that answers your question. And then I'm not a policymaker, so.
Caveat that I'm also not a policymaker, but and I'm not also on the panel. But thank you for throwing that question. I mean, I should let me just say real fast that my day job is as a diplomat typically, and working now on the Hill and learning that trade craft as well. And I would say there's a little bit of overlap in this bit. And I'm going to tell a quick anecdote. I'm sorry. One of my first bosses in the U.S. Foreign Service explained that as I was tilting at every windmill out there and trying to fix every problem in the world, that what our job is really about, what she called pop diplomacy, which was perspective and opportunity at the right moment makes policy. And what I see with our policymakers is very much that same thing, that whether it's an election cycle or budget running out or something like that, that sort of what the actual panel had said earlier about ensuring that they've had the opportunity to develop that perspective, meeting survivors, whether we can get them out to retreats, God help you to do that in America, but that's wonderful if you can do that. But just giving them that perspective over time, and their staff probably much more importantly over time, then when that opportunity does present itself, then a policy can actually cross the finish line. Now, waiting for that opportunity is maddening, but occasionally that it comes up.
Great. Well, thank you all for your questions, and thank you, Joy, Mirella, Helga. 3 really different projects and really different perspectives on the issues, but a lot of commonalities and a lot of patterns here about the ways that bias and misinformation tend to matter. And I'm really happy to hear all of the things that you've done that actually work and make a difference. So thank you so much, and thank you all for your engagement as well.